Rwanda is a small but rapidly developing country located in the heart of East Africa, widely known as the land of 1,000 hills. Today, Rwanda is the most densely populated country in Africa, with a population of 10.5 million people. In just 18 years since the country's devastating genocide, Rwanda has succeeded in rebuilding its health system and significantly improving the health of its population. Germany's support to Rwanda's health sector began in 1979, when DED began to place German health experts to provide medical education and clinical services in Rwanda. Over time, German support expanded geographically, technically, and financially. The German cooperation provided this technical and financial assistance through several different institutions. In 2011, GIZ was founded as a single implementing agency for technical cooperation, integrating the former GTZ, DED, and Invent. SIM is also a part of GIZ, while KfW is responsible for providing German financial cooperation. Together, these agencies form GDC, the German Development Cooperation, which is funded by the Federal Ministry for Economic Cooperation and Development, BMZ. Now, after more than 3 decades of continuous cooperation in the Rwandan health sector, German involvement will come to an end in 2013. It was jointly decided by Rwanda and Germany to focus cooperation on 3 other sectors, in accordance with Rwanda's proposal for a division of labor among its development partners. Germany's support to the health sector aimed to improve the health and well-being of the Rwandan population. As we reflect on 35 years of cooperation, let's see what health means to our Rwandan partners.
La santé en général, comme on le dit, bon, c'est un état complet de bien-être, que ce soit physique, que ce soit mental, que ce soit social.
C'est la potentialité de l'organisme à s'adapter à des conditions socio-économiques et climatiques.
Moi, j'ai vu que la santé, ça va dans tous les sens de la vie en général.
In preparation of the phasing out of the health sector, we went on a farewell roadshow through our partner districts, Musanze, Gikumbi, Naruguru, Gisagara, and Huye, as well as a final event in Kigali. This was an occasion to come together with our partners and celebrate the cooperation between Rwanda and Germany. During 35 years of continuous cooperation, German technical and financial cooperation amounted to more than 60 million euros. In the 80s and 90s, German support focused on nursing education, training and supervision in local hospitals, care and drug supply, as well as family planning, sexual and reproductive health, and HIV prevention. In 2003, health became one of the German Development Cooperation's 3 priority areas in Rwanda, and the first steps towards a sector-wide approach were adopted. This approach aims to provide more coordinated governance under the leadership of the Ministry of Health.
Ce qu'on peut dire qui a été une bonne chose, c'est la flexibilité avec le temps. C'est-à-dire que le secteur de la santé au Rwanda a évolué au cours du temps et l'appui que la coopération allemande a donné a aussi évolué et changé avec les transformations de ce secteur santé pour chaque fois essayer au mieux de répondre à nos besoins.
Ich glaube, die Stärke des deutschen Beitrages, und man hat das besonders in den letzten Jahren gesehen, ist die Kombination aus vielen verschiedenen Ansätzen, vor allem der technischen Zusammenarbeit, aber auch der finanziellen Zusammenarbeit und ein ganz starker auch Beitrag zur Koordinierung, nicht nur mit den ruandischen Partnern, sondern auch mit den anderen Entwicklungspartnern.
The German cooperation has taken a multi-level approach to support the Rwandan health sector, targeting both central and decentralized levels, and collaborating closely with other development partners. Rwanda's Ministry of Health was the main partner of the German cooperation at the central level.
Ils ont appuyé non seulement au niveau des districts, mais aussi dans les groupes de réflexion, les groupes techniques. Et je crois que ça, c'est une contribution importante pour un pays comme le Rwanda, où après 1994, après le génocide qui a eu lieu ici, où le système de santé était détruit, Ils ont contribué vraiment à redémarrer le système de santé du district et c'était un nouveau concept.
I think what is most remarkable is this ownership from the Rwandan government. So all the things were based on the strategies and policies. The Rwandan government was the driver behind.
Support at the decentralized level targeted 5 partner districts, as well as their 6 district hospitals and the University Teaching Hospital of Butare. At the decentralized level, technical advisors worked closely with district health units, hospitals, and health centers. This assistance included support for strategic planning, coordination, and capacity development, as well as logistical support. For Elizabeth Gerbach, the coordinator of the health program since 2008, there are great similarities between Rwandans and Germans.
When I arrived here in 2008, I had the feeling that we are quite similar in how we approach things. When we know what we want to do in the future, the Rwandans are like sisters and brothers to the German population.
Since 2003, the health program focused on strengthening 3 main components of the health sector. The first component, health financing and system development, included support for health financing, community-based health insurance, performance-based financing, public financial management, and decentralization.
The German cooperation has assisted us to develop training manuals for district health facility management system in Rwanda.
C'est un projet vraiment qui nous a beaucoup aidé pour monter le niveau de la compréhension de la mutuelle de santé au niveau de la communauté de base.
The second component of the program focused on sexual and reproductive health and HIV and AIDS. This entailed support to central and decentralized levels to promote family planning, maternal and child health, adolescent sexual and reproductive health, as well as responding to HIV and gender-based violence.
J'ai travaillé pour la santé de la reproduction des adolescents. J'ai fait des formations des pères éducateurs. J'ai aussi fait des réunions de groupes multisectoriels de GBV.
There was a lot of special events in cells, in sectors. So we had a chance to discuss with them about family planning, about health, of reproductive health.
The third component provided support to the areas of human resource development and health technology management. This component mainly encompassed the provision of medical equipment and capacity development in the area of medical equipment maintenance. It also included support for medical education through training, continuing education courses, and bedside teaching.
I would say the most interesting for me has been that we've had exposure of our students to good practices because of the German-funded consultants that have been working, especially in our teaching hospitals.
These 3 components were complemented by 2 overarching topics: the sector-wide approach and joint financing through sector budget support and pooled funding.
Le sector-wide approach, je crois que la GIZ au niveau du secteur santé a été très très dynamique pour pouvoir d'abord discuter du concept en général avec le ministère, avec les bailleurs, et puis de pouvoir voir quelle est la possibilité de le mettre en place au niveau des districts et au niveau central.
Because there is such a long history of work, such a long experience, I think they have built a memory, or let's say institutional experience of the health sector in Rwanda that has actually helps linking different subsectors and thematics together. And that has been as well extremely useful in order to develop public policy or operational policy in the health sector.
Let's have a look at the community-based health insurance, which is an important area of support for the German cooperation. The insurance, commonly known as Mutuelle de Santé, was a cornerstone of access to healthcare for approximately 9 million Rwandans in 2011. The German cooperation has been a key partner in the development and implementation of the Mutuelle de Santé through policy development and coordination, as well as training of local partners and community mobilization.
naje hano umwana arembye atonka iyo nza kuba nafite mituweli de sante byari kungura kubona amafaranga yo kwishyura.
Back to our tour through the partner districts. We start in Musanze, located in the north of Rwanda close to the famous volcanoes and mountain gorillas. What do our partners in Musanze say about the support provided by the German cooperation?
Ce que j'ai aimé avec la coopération, c'est comment ils ont essayé d'aller avec le processus de décentralisation de notre système. C'est nous qui planifiaient et eux, ils voyaient ce qu'ils peuvent nous appuyer dans ce sens.
Ils nous ont assisté techniquement en envoyant des médecins expérimentés, des spécialistes, des gynécologues, des pédiatres. Alors ils ont aidé à traiter les malades, mais en même temps aussi à former les médecins, de façon qu'aujourd'hui nous avons les médecins qui peuvent gérer les cas que nous avons dans les grands départements de l'hôpital.
Development worker Yakuba, who has been working in Rwanda-Germany Hospital for 2 years, provides an insight into his work.
La coopération allemande m'a accueilli ici, au Rwanda, pour travailler. Et quand je suis arrivé, mon intégration a été facile. Parmi mes attributions, bien sûr, il y a la formation des jeunes médecins et du personnel sur place. Il y a aussi les soins cliniques. Et il y a aussi l'amélioration du cadre de travail de l'hôpital, mais particulièrement, il y avait la prise en charge des fistules.
Our next stop is Gicumbi, a mountainous district also located in northern province, which is known for its excellent tea. Gicumbi has been a partner of the German cooperation for 3 decades.
Les indicateurs de santé ont beaucoup évolué, surtout en ce qui est par exemple, la planification familiale, surtout en ce qui est, par exemple, le suivi des indicateurs de santé, parce qu'avec la GIZ, on a pu suivre de près le fonctionnement des centres de santé, l'aspect monitoring and evaluation des centres de santé.
The German cooperation also supported Byumba Hospital with, for example, social funds to improve access to care for the very poor. The Byumba Nursing School, which was constructed with German support in 1996, has also been a long-standing partner.
For me, the most important contribution from the German cooperation to the health sector is that they promoted the nursing profession straight after the genocide. They rehabilitated a nursing school, Byumba Nursing School.
Now let's go to our 3 partner districts in the south, starting with Nauru-Guru. Capacity development was the main focus of support to the district and the district hospital in Munini.
On a appelé un médecin spécialiste en gynéco-obstétrique qui a formé toute notre équipe ici médicale.
Je participais dans les formations en tant que soit formateur, soit participant, et je regagnais le terrain pour mettre en pratique ce que j'ai appris au niveau des formations.
Moving eastwards, we now reach Gisagara, a district with 2 hospitals, Kakoma and Kibalizi.
Dans le processus de planification, j'ai apprécié l'accompagnement, l'assistance technique.
Ce sont des activités qui sont vraiment très importantes à rapport avec la gestion de l'hôpital et à rapport avec la meilleure prise en charge.
The last station on our tour is Huye. Huye is home to the National University of Rwanda and the University Teaching Hospital of Butare, CHUB, a national referral hospital which has been a partner of the German cooperation since the 1980s.
Mieux que des équipements, mieux que de l'argent, nous avons eu des ressources humaines, des gens qui sont venus réellement travailler sur le terrain et nous aider à surmonter les priorités. En matière de soins, en matière d'enseignement, et qui ont même participé à créer des unités qui n'étaient pas fonctionnelles avant.
Leaving CHUB, how do our partners in Huye District, Kabutare Hospital, and the Dushisoze Youth Center describe their experiences and activities?
La coopération allemande appuie aux indigents dans les soins de santé ici à l'hôpital.
The program we have been working with KfW include family planning, youth and reproductive, especially in out of school. There was also an integration of family planning sessions into the normal service here at the youth center.
Peer education has been a special focus of the health program. and Huye is one of the 4 districts where a group of young volunteers, selected by local health centers, are trained in sexual and reproductive health as well as theater and sports.
Theatre ndayikunda kuko ni umukino burya ujya umfasha mu buzima bwanjye bwa buri munsi cyangwa no kuba numva naruhuka mu mutwe nkaba nabasha kuba nareba nk'icyiza runaka se cyangwa n'ikibi cyugarije umuryango nyarwanda.
N'aya mahugurwa turimo kuko yabashe kuba yanyigisha byinshi nkaba mbona future yanjye hari byinshi ngomba guhindura mu muco ubu ngubu wari waragiye uhinduka.
During our roadshow, they demonstrated how theater can be a powerful means to raise awareness on gender-based violence, sexual and reproductive health, and other issues. We have completed our tour through the partner districts and through the 35 years of Rwandan-German cooperation in health. As we are leaving Rwanda and our partners on the central and decentralized level, we want to know, how will Rwanda's health sector develop within the next 35 years? What are our partners' visions and wishes for a healthy future for the Rwandan population?
Ma vision pour l'avenir, c'est qu'on va continuer à être équitable, c'est-à-dire à donner les mêmes chances à tous, ou du moins d'une façon proactive, faire en sorte qu'il n'y ait personne qui soit exclu. Donc, renforcer l'assurance santé et aussi renforcer le paquet de services que l'on donne avec l'assurance santé.
I would hope very much that in the future, Rwanda will have such a system of very qualified hospitals and very qualified services for the people.
In the next 35 years, it is my belief that Rwanda will no longer be a low-income country. Rwanda will be a middle-income country and maybe on the top tier of the middle-income or even high-income country.
I think with the other partners, if the German cooperation withdraws, we are also continuing. We are not going back. We are going to continue.
À partir de notre vision 2020, pour moi, on verra qu'est-ce qui est bien fait, qu'est-ce qui n'est pas bien fait.
I think in 35 years to come, Rwanda will be a better place to be.
We warmly thank all of our partners, health teams, and contributors to this film. We wish you all the best for your future and the future of Rwanda.